Welcome to the Sound of Ideas from IdeaStream Public Media. I'm Stephanie Haney. Thanks for being with us. The Ohio Department of Health has confirmed the state's first measles outbreak of 2026. 3 pediatric cases and a possible fourth had been identified in a single household in Cuyahoga County. All of the children were unvaccinated at the time of exposure. Measles is highly contagious and spreads easily through coughing and sneezing. It is preventable, though, and health officials say 2 doses of the measles, mumps, and rubella, or MMR vaccine, are 97% effective at preventing infection. The disease can be especially serious for young children. As many as 1 in 20 children with measles will develop pneumonia, the leading cause of measles-related death. This outbreak comes as a new variant of the flu, Influenza A, which has been nicknamed the super flu, continues to wreak havoc across the country. So far this flu season, more than 1,900 Ohioans have been hospitalized from the flu. Today, we'll talk about how infectious diseases spread, the role that vaccine hesitancy might be playing in what we're seeing across the country, and what you can do to protect yourself and the people you love and try to stay as healthy as you possibly can. Joining us in studio today, we have Dr. Prakash Ganesh, Medical Director of the Cuyahoga County Board of Health. Dr. Ganesh, thanks for being here.
Thank you for having me.
We also have with us by phone Dr. Amy Edwards, Pediatric Infectious Disease Specialist at University Hospitals. Dr. Edwards, thank you very much for being with us.
Thanks for having me.
If you want to be a part of this conversation, if you have a comment or a question, you can give us a call. That number is 866-578-0903. You can also send us an email at soi@ideastream.org. And you can also send us a message on Instagram at The Sound of Ideas. We'll start the conversation today talking about something that doesn't get quite as much attention as it has in years past, COVID-19. Dr. Ganesh, I want to ask you, what do cases look like in Cuyahoga County? Did we see a spike during the holidays?
We have not seen the increase in cases as we have with other respiratory illnesses, but we're just closely watching it to make sure that we don't see a spike. I mean, I think with the season progressing, we might see one coming up.
Okay. And how often does the Board of Health here in Cuyahoga County update that dashboard on COVID-19? It looks like on the website it may not have been updated since September.
Yeah, we are usually monitoring it every week, so we get new reports every week on all respiratory illnesses, so RSV, flu, and COVID-19.
Okay. And so the public-facing part of it might not necessarily be updated as often?
Exactly.
Got it. Thanks for letting us know about that. Now let's turn this conversation to the measles. Dr. Edwards, should Northeast Ohioans be concerned about learning about these 3 cases of measles reported in Cuyahoga County?
I mean, it's certainly not the best news. We would prefer to have no cases of measles in Cuyahoga County, but my understanding is, they are isolating at home. We haven't heard of secondary cases yet outside of the family. We're just sort of waiting and seeing and monitoring the situation at this point.
Okay. Now, we do know that these 3 cases are in children who were not vaccinated in the same household. Is that something that you're seeing? Are you seeing vaccine hesitancy among the parents of your patients, Dr. Edwards?
Yeah, vaccine hesitancy is something that's existed since vaccines have existed. There's stories of it even back with the smallpox vaccine in the Revolutionary War. But certainly what we've noticed in the last few years is more vaccine hesitancy than we'd seen in times past. And I think the difference in what we're seeing now is, in years past, parents were very open to talking about it. They were open to learning. They were willing to have open conversations and kind of back and forth. And, they would express their concerns. We would help them understand, the truth of vaccines. And you could still have that conversation and relationship. Now, that does still exist. A lot of vaccine hesitant parents are still willing to talk, but we see a lot more who are just absolutely unwilling to even discuss it, who will get very belligerent or angry if you even try to bring it up, who will, even call you names to your face and things like that. It's a very different type of vaccine hesitancy than what we've been used to in the past.
Dr. Ganesh, what's been your experience? Is that something we should be concerned about in Ohio right now, vaccine hesitancy?
Yeah, I mean, just as Dr. Edwards said, it is a very different landscape now dealing with talking about vaccines with families. As a primary care physician as well, I mean, I get to know my patients over time, and I've known many of them for many years and take care of many members of their family. So I do have the conversation over and over again sometimes, but I know if there's an opening, I try to take it. If not, I back off.
Does it seem, I know Dr. Edwards had mentioned this is something that dates back historically. Does it seem like it's happening more now? Are we more aware of it? What's the temperature that you're getting in that regard?
I mean, I think it's a very different landscape that we live in now. Information is flowing much more freely than ever before. So I think people are getting information quickly, but we are hearing more information more rapidly as well. So I think it's on multiple fronts, but it is something that I am concerned about, and I've talked about with our health department in making sure that we are able to battle misinformation out there.
That's interesting too. You know, when we hear about information sort of flooding at us,
Yeah.
information does not mean true facts. It's just kind of words bombarding us sometimes, and you're just not really necessarily certain about the source of things.
Exactly.
We have a call now from Lucy in Seven Hills. Lucy, welcome to the Sound of Ideas. Go ahead.
Yeah, good morning. Couple things, the vaccinations as well as mask wearing. I do believe that it's important to get vaccinated. However, I believe it's a person's choice. Whereas with mask wearing, to prevent the flu A, my niece was here, got the flu, wound up in the ER. I know other people who are really sick from the flu, so I'm a caregiver. I take care of 90-something, and my father-in-law is also in the hospital. And I'm pretty upset that there's a certain family member who refuses to wear a mask when this person comes to the hospital. So, you know, I think mask wearing should not be optional, but I think that vaccinations, even though they are a good thing to do, they should be a person's choice. Thank you.
Thank you for sharing your perspective, Lucy. And Dr. Ganesh, I'll turn to you on the topic of mask wearing. If you're watching us on the Ohio channel or on the IdeaStream Public Media YouTube page, you may have noticed Dr. Ganesh is wearing a mask. So what do you say to people who are having a hard time with family members, and why are you wearing a mask today?
Well, I'll start with myself. I'm wearing a mask. As you can hear, my voice is kind of hoarse. I've been losing it over the past weekend. And I also don't want to spread the infection to other people if I have something. I recommend, it's a simple thing we can all do to take to protect our families and our loved ones. I saw a family just last week that I diagnosed in clinic with influenza type B, and they had a newborn in the house, and they were trying to do everything they could to protect that newborn who could not get vaccinated, who was 4 weeks old. So they were wearing masks, they had been vaccinated, they were doing everything they could be. And so I try to plead the case that you need to not just worry about yourself, but you are looking out for other community members, other vulnerable people in the community, your grandmother who may have COPD, who may be on oxygen, all sorts of things, all sorts of scenarios that are out there.
Let's continue the conversation on measles for a moment. Dr. Edwards, can you break down for us, how is measles contracted, and how would someone know if they get the measles?
Well, measles is a respiratory virus, and so it spreads the same way other respiratory viruses spread. Droplets, coughing, sneezing, that sort of thing. It's very contagious, as you mentioned kind of early in the segment. It's one of the most contagious viruses that we know of. Almost every single person who's exposed to it who's not immune will get it. And so it's spread the normal ways. But as far as knowing that you have it, in the early stages, it's a respiratory illness. So the coughing, the sneezing, you might get pink eye from it, that sort of thing. So it's not really going to be that much different than a lot of other respiratory illnesses. And generally, it's not until you break out in that more classic rash that's associated with measles that you know that it's something other than, a typical respiratory illness, which is part of what makes measles so difficult to control. If you go back historically, before there were vaccines or even in outbreaks in unvaccinated communities, part of why it's so difficult to control is that you don't know you have it until you've already been contagious for days and days, and it's so contagious that it's nearly impossible to control, which is why the vaccine has just been so amazing.
Does everyone who gets the measles get that rash?
The people who who are not vaccinated, sometimes in partially vaccinated individuals, we'll see a more atypical measles and they may not have the classic rash. And then in some people whose immune systems function slightly differently or whatever, we may see the rash look a little bit different. But generally, yes, pretty much everybody gets that rash.
Okay. And Dr. Edwards, what does a minor case of measles look like compared to that life-threatening case? And who's most at risk of those life-threatening cases?
Well, the people who are most at risk are going to be the young and vulnerable, so kids under 5, but really it's the kids under 1 who are really, really high risk. And then anybody whose immune system, is very compromised, is also at risk. And what we see is it's really the complications of measles. It's the ones who get the bad pneumonias, the ones who get the brain swelling, what we call encephalitis, that sort of thing, that are the ones who are at high risk for dying or needing to be in the hospital for more advanced medical care. Most people who get the measles, especially if you're like a school-age child, are going to have that respiratory illness. Then you're going to have, some fevers. You're going to have that rash. You're going to be miserable for several days, a week, and then kind of a slow recovery after. That's more the typical, for those of us who have grandparents or great grandparents who lived through and survived measles. That's the classic story. But even there, with mild cases, there's risk of injury to hearing, risk of injury to vision. There's even risk of injury to your brain long term. And universally across, whether it's mild or more severe, everybody who has measles risks damage to their immune system.
We have a call now from Jay in Canton. Jay, welcome to the Sound of Ideas. Go ahead.
Yeah, I sort of follow up on it. If you have measles as a child, do you develop like a lifetime sort of immunity to measles then, so you don't have to worry about it later on?
Thank you, Jay. And Dr. Ganesh, I'll ask you that question. If you've had measles as a child, if you were never vaccinated, are you immune to it for life?
Yeah, that's a great question. Usually it provides lifelong protection. So before the vaccine, 1957, people were born during that time. Most of them had been exposed and had measles, so a lot of them have lifelong protection. If there is a question, your doctor can also check your titers and make sure that you still have immunity if there is some kind of question for that.
Okay, thank you for that. Now, Dr. Ganesh, the U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr., he's claimed that the MMR vaccine, which includes the vaccine for measles, causes autism, and also that vitamin A can treat measles. Is there any truth to either of these claims to your knowledge?
No. I think on those both points, measles, the effectiveness is amazing, that we don't see in a lot of vaccines. 93% with one injection and 97% with 2. And we've seen just in that household and in previous outbreaks that the spread of this has only been targeted for the unvaccinated folks. Vitamin A is not a cure. There has been giving supplementation for people who are deficient in vitamin A might be helpful to stop those long-term effects or consequences of measles infection, but it's not a cure and it's not preventable. It doesn't prevent measles at all.
Okay. Dr. Edwards, if someone doesn't get their child the measles vaccine at the recommended time, which I would love for you to remind us what the recommended time is it ever too late to get the measles vaccine?
Oh, it's never too late to get the measles vaccine. Anybody can get it at any time. Obviously, there are a few health conditions, most especially having problems with your immune system that could mean that you can't get it. So you'd want to check with your provider to make sure that it's safe. But for the vast, vast majority of people, it is safe. And yes, you can get it at any time. We do recommend the first dose of measles vaccine at your 1-year visit with your pediatrician. And the booster Typically, we give it somewhere right before the kid is going into school, but the booster can be given as early as the 18-month visit if you want to get both doses out of the way quickly. Or, as I said, it's most often given somewhere in that 3, 4, 5 year visit before school starts. And as mentioned, it's highly effective, and that 2-dose series has shown to have protection for decades and decades. And so it's really, if you kind of just get it done, then you're done, and you don't really have to think about it anymore.
Okay. I want to remind our audience we've been talking about infectious diseases. It is that time of year when everybody's getting sick. I know I was sick myself at the beginning of the year. Missed a couple of days of work because of it. So if you want to be a part of this conversation, you can give us a call at 866-578-0903. You can also send us an email at soi@ideastream.org. Now, let's talk about the super flu, the so-called super flu. Dr. Ganesh, can you talk to us about this particular strain of the flu that seems to be making so many sick? Why are we calling it the super flu?
It's a new variant that has come out, subclade K, which is influenza A type infection. It's been causing a lot of cases of influenza and driving the surge is what we believe right now, beginning last week. And I think that's why they call it the super flu. But as we're seeing now, the vaccine that we have available is proving to be more effective than we originally thought against this super flu, if you want to say that.
Okay. And how does the super flu present differently, Dr. Ganesh, than the common cold?
I mean, I think it's going to show similar to flu. So high fever, cough, runny nose, typical symptoms. Symptoms you want to watch out for are still typical of other flu types. So trouble breathing. If you have other comorbidities like asthma, COPD, you might want to talk to your provider if you're having more and more difficulty breathing.
Dr. Edwards, from what you've seen in your practice, does this year's flu shot seem to be more or less effective because it wasn't created to fight against this newest strain? How's it working for your patients?
Well, so I'm a pediatric infectious disease doctor, and I'm primarily an inpatient clinician, meaning I mostly see patients who are admitted to the hospital. And unfortunately, what we're seeing is the kids who are admitted to the hospital are the ones who are not vaccinated. Obviously, there are plenty of unvaccinated kids who are not being admitted to the hospital. But as is pretty typical with children, a good percentage of the population does not generally get vaccinated against influenza. And what we see is those who are unvaccinated are more likely to need hospitalization than those who are vaccinated. And, it's not a perfect match, especially the A part of the vaccine. But vaccines do what we call cross-reacting, which means, yes, you made antibodies specific to what was offered in the vaccine, but those antibodies can still cross-react with other viruses that are similar to, even though they're not exact. So initially, when we saw that mismatch, I think there was a lot of concern that the vaccine really wouldn't work. And it's not doing a great job. Would we all wish for a better flu vaccine? Sure. But let's get those researchers some money and get some better and better and better flu vaccines. But it's working pretty well. It's working maybe even a little better than we worried that it would at the beginning of the year, at the beginning of the flu season. But what we're seeing clinically, and I've over the last 6 weeks done about 4 weeks of service at Rainbow at our children's hospital. What we're seeing is just kids coming in with complications from flu just constantly. The hospital is full, and these kids are sick. And it's just really, it's one of the worst seasons that I can remember. And that's saying something, considering last year was one of the worst flu seasons that I could remember in a long time. So it's been a rough year for flu, and we're not anywhere near being done.
Little anecdote that I'll share. I got the flu shot in October. My husband did not. I don't know what we had because we didn't get tested. You can get tested for the flu, as we know. But I do know that he had this sickness a lot worse than I did. So if we did have the flu, I'm wondering if that helped me at all and thinking, maybe it did if that was the case. Now, Dr. Ganesh, the U.S. Department of Health and Human Services now recommends against vaccinating for the flu, COVID-19, and rotavirus without consulting a healthcare provider first. So what do you say to that as the medical director of the Cuyahoga County Board of Health?
I mean, I think it draws a lot of confusion. I think in general, most vaccines are done in consultation with a medical provider. I mean, that you see more and more access through pharmacies, but in general, there is a lot of conversation, but it ends up bringing up more questions against many of the vaccines that are out there already and have proven to be effective. And then also, the concern is insurance coverage. Is insurance going to cover some of these vaccines based on some of the changes that are happening federally?
Where can people get the flu vaccine if you don't have a primary medical caregiver or health insurance?
So there's various programs that offer it, but us at the health department, at the Cuyahoga County Board of Health, we have a clinic and we offer vaccine in our clinic. And it's very, depending if you're insured or uninsured, we do offer options for people. Many community clinics are out there that offer the flu vaccine as well. And then still our local pharmacies are still offering it as well.
Okay. Dr. Edwards, in your experience, from what you see, if people don't get the flu shot every year, when they do get it, does it have any effect on the effectiveness of when you do get the flu shot?
In children, especially very young children, it can. Sometimes in that first season that a kid is getting their flu shot, we actually recommend 2 doses to kind of more effectively jumpstart that immunity. But that is partially dependent on the age at which you start to vaccinate your child against the flu every year. But if you didn't get it last year but are getting it this year, no, that shouldn't really, for most people, it shouldn't be a problem. It's really only the very young kids in their first or second flu season who have never had a vaccine before that we might offer 2 doses just to help boost it a little bit better.
Okay, thank you. Dr. Ganesh, one more question on the topic of vaccines here. We are talking about it less now. Should we still be getting the COVID-19 vaccine?
Yes, because it's now being formulated every year, just like the flu vaccine. So it's targeting the most common variants that are circulating. So every year in my clinic, I get patients that are saying, "Oh, I already got the COVID shot," but it's several years old when I actually look at their record. So getting a booster dose will help cover the most recent variants that are circulating.
Okay. That's all the time we have for our conversation now about all the things that are making us sick across the country. I want to thank our guests for being with us today. Dr. Prakash Ganesh, Medical Director for the Cuyahoga County Board of Health. Thanks for being here.
Thank you.
And Dr. Amy Edwards, Pediatric Infectious Disease Specialist at University Hospitals. Thank you for taking the time.
Thanks for having me.
We'll take a quick break now, and when we come back, we will look at the biggest risks globally, economically, for 2026, according to one international policy expert. This is The Sound of Ideas. I'm Stephanie Haney. We'll be right back. This is The Sound of Ideas. I'm Stephanie Haney. Thanks for staying with us today. When we started the show, we were talking about infectious diseases here in Northeast Ohio. And quick update for you, Dr. Ganesh did let me know as we were wrapping up the segment, there was a 4th probable case of measles within the same household. That is now a confirmed case of measles. So now 4 total cases of measles in Cuyahoga County, all within the same household. Right now we move on to our second conversation for today. We are just a week and a half into 2026, and international news is happening just as fast as ever. The Trump administration's removal of Venezuelan leader Nicolas Maduro was a shock to a lot of people. The president has also continued to make comments about taking over Greenland, and as recently as yesterday, continued talking about potential military actions in Iran. Artificial intelligence, climate change, and other factors will continue to shape international policies in new and sometimes unpredictable ways as we look ahead to the new year. Now, tonight, the Cleveland Council on World Affairs will host Michael Wiedekall for a discussion called The Global Economic and Risk Outlook for 2026. Michael is the founder and executive director of International Strategic Analysis. He speaks at the Parma Snow branch of the Cuyahoga County Public Library tonight at 6 p.m. and is with me now in the studio. Michael, welcome to The Sound of Ideas.
Thank you. Thank you for having me. So much positive news to start the day with.
A lot going on for sure. It is coming fast, absolutely. And we are going to dig into it today. And we want you to dig into it with us if you are watching or listening to the show. If you want to be a part of this conversation, give us a call at 866-578-0903. You can also email us at soi@ideastream.org and send us a message on Instagram at The Sound of Ideas. Now, Michael, here around Northeast Ohio and globally, I understand that you say uncertainty is the key word. High level, why is that?
So much is happening, and so much is happening at such a rapid pace. So no matter where I speak in the world, no matter who I'm speaking to, the message is always the same. What's going on? There's uncertainty in the business world, there's uncertainty in the political world, and this is causing a lot of problems for all different aspects of life. Decision making, businesses, do they spend money, do they wait? Communities, do they invest in a major infrastructure project or do they wait on down the line? So this is a very uncertain time that we're living in.
Technology advancing, I'm sure, plays a role in that. How big of a role will that be?
A massive role. Nobody really knows what the impact of AI will be, for example, on the economy, on people's careers. If you're a young person at university and you're studying to be a lawyer or an accountant, and suddenly a lot of those jobs are being replaced by AI, your future is highly uncertain. Businesses don't know how much to invest in AI because they're being told that if they don't invest, they're going to fall behind. But on the other hand, they don't know necessarily how to apply AI into their everyday business.
Let's talk about something really specific that just happened. We know that there was conversation about a criminal indictment against the Federal Reserve for renovation of historical buildings, and the chair of the Federal Reserve, Jerome Powell, came out and spoke out against this the other day. What does that do to the level of certainty or uncertainty that people are looking at from what to do financially?
It makes it even worse because one of the core elements of policymaking is that the Federal Reserve, all central banks, are independent of their governments. They make decisions independent of political pressure. And now we're seeing that political pressure is being applied to the Federal Reserve at a level almost never seen before. And this is causing a great deal of uncertainty. We've seen investors pull away from the US dollar over the past day because of this. So again, just adding to that uncertainty that businesses and investors are facing.
Now, we know hindsight is 2020. Some things have crystallized, but when we look back at 2025, what were the biggest factors that were creating uncertainty at the beginning of the year and that may have persisted?
Well, the big one last year was trade. Trade policy caught a lot of people off guard. There was an expectation that some form of tariffs would be put in place on imports into the United States, but the haphazard nature of those tariffs really caught a lot of business leaders off guard. Tariffs were changing day to day. The countries that they were applied on were changed from week to week, and this caused a huge amount of uncertainty. Businesses didn't know how much their imports were going to cost. For example, if you're building a car here in the United States, a lot of the materials that go into that car have to be imported. And the cost of those materials was changing week to week because of these tariff changes. So it was, again, breeding a great deal of uncertainty. So trade was the dominant uncertainty that was added to the world in 2025. There are many others, but that was the big one.
Will we expect that uncertainty over tariffs specifically to continue into 2026? What will that look like?
It's possible. We've just seen the Trump administration announce that they may put 25% tariffs on all countries that trade with Iran. And that includes China, which is a major trade partner of Iran, India, which is a major trade partner of Iran. So I think we're going to continue to see some of this haphazard nature with tariffs continue.
What are the most common questions that you're fielding, to switch gears now, about what's going on between the U.S. and Venezuela? And how do you respond when you say there is so much uncertainty?
Well, the first thing is, what exactly are we doing in Venezuela? It was a rather incredible operation carried out by the U.S. military to go into an airbase and seize the president of Venezuela. But there doesn't seem to be any particular plan on what are we going to do next in Venezuela. There's talk that we're going to control their oil industry, that we're going to run the country, but we don't have any troops on the ground. We've seen that elements of the Maduro regime have basically retaken power. They control the streets, they control most of the infrastructure in Venezuela. So what does that mean that the United States is going to control the oil industry, control the country as a whole? At the same time, we've seen oil companies here in the United States say, we're not really interested in going into Venezuela. Tapping that oil and rebuilding the oil infrastructure there could take a decade or even longer. So a lot of companies are not just that interested in going into Venezuela. So there's a huge amount of uncertainty again. What exactly does the future of Venezuela look like, and what does the United States' role in Venezuela's future look like?
What is it about the oil industry that is particularly uninteresting to the American oil industry in Venezuela?
There's a few things. I mean, you'll see the statistic a lot that Venezuela has the world's largest oil reserves. Now, that is a very disputed statistic. Another thing is that there's been no investment in the oil infrastructure in Venezuela. So to really get the oil out of the ground in Venezuela is going to take a huge amount of investment, which is going to take a lot of time. Another thing is that Venezuela has a very heavy, kind of sludgy type of oil, which means you need high oil prices to make it profitable. Some economists estimate almost $80 a barrel, and of course oil prices are far below that at the moment. So there are a myriad of factors that are just making the Venezuelan oil industry not very appealing for U.S. oil companies.
Another big foreign policy story that's very fresh, the president is talking about taking control of Greenland. So whether that happens or doesn't happen, what would either of those realities mean for 2026?
They would mean a lot. First of all, this is causing a big rift within the Western alliance. We've seen European countries kind of rally to Denmark's defense in terms of its claim to Greenland. Excuse me. It's clear that if the Trump administration decides they want to go into Greenland, they're going to. There's nothing the Europeans can do militarily to stop the United States from going into Greenland and seizing control of it. But obviously, then you're looking at a fractured alliance, which may never recover from such a blow. You're looking at, down the road, other countries saying, why can't we follow a similar path? Think about China with Taiwan. Think about what Russia's doing in Ukraine. And this opens a whole can of worms that we could be looking at a world that is far less stable than it was just a couple years ago.
We have a call now from Jeff in North Royalton. Jeff, welcome to the Sound of Ideas. Go ahead.
Yes. I wonder to what degree is the flood of information balanced against the quality of that information. And I look back to, in the 60s and 70s, we had a 30-minute national news program. Now we have 24 hours of news. They've got to fill that somehow. And during that same period, no one ever mentioned the stock market on the nightly news unless it was a really, really huge story. And people don't have what they need to evaluate, well, is this really important or not? Or is it the fact that somebody said it on radio or television or, God forbid, the internet, it must be important?
Thank you for the question, Jeff. So, Michael, I'll ask you, how do we balance the flood of information and kind of try to parse what's quality information versus what's noise and maybe space filler sometimes?
That's a great question. We are dealing with a world now where we have access to more information than ever before. I've seen a statistic that the average 6-year-old today has more information access in 5 minutes than Thomas Jefferson had in his entire lifetime.
Wow.
And the quality of information is the key. And we're seeing, especially now in this world of misinformation, where more and more information is going out there, which is either not factually correct, has an agenda behind it, is being created not by humans anymore, but by AI. And so the amount of information is overwhelming, and then being able to identify what information is correct, what information is real, what information is not, is hugely challenging. And I've had a couple articles about this here in the Plain Dealer and some other newspapers, where we really need to educate our society to be able to identify what is real and what is not. There's a real concern that I have that within a couple of years, it'll be almost impossible to identify what information is correct, what information is real, and what information is not. And that has huge ramifications for our politics, for our economics, for everything in our life.
I think about that all the time when I'm scrolling social media and you start flipping through a carousel that has facts that are speaking to me. And I'm thinking, okay, wait a minute. I don't know if this is actually true. And you really do have to consider the source and try and parse all of that information. It's definitely not easy. I want to remind our audience that we are talking about global risks and economic outlook for 2026. We have analyst Michael Weidekal here with us. If you want to be a part of the conversation, the number to call is 866-578-0903. You can also email us at soi@ideastream.org. Now, Michael, the Monroe Doctrine has come up as of late. President James Monroe's proclamation from the 1820s that the Western Hemisphere is for the U.S. That's a U.S. sphere of influence. As of late, it's even been called the Monroe Doctrine as shorthand for being representative of President Donald Trump's views. How much uncertainty does that cause for 2026?
It certainly adds to the uncertainty because I do believe that the Trump administration is actively seeking to reinforce the Monroe Doctrine. We've seen this play out in Venezuela. We've heard the Trump administration talk about retaking the Panama Canal, retaking control of the Panama Canal. We see what's happening in Greenland, which is geographically part of North America. We're looking at Colombia having some uncertainty. Their president, Gustavo Petro, has been threatened on numerous occasions by the Trump administration. We've heard the Trump administration talk about sending troops into Mexico to deal with drug cartels there. This is a clear policy that is being followed by the Trump administration very aggressively, and I think the success, at least the initial success they've had in Venezuela, will embolden them, in fact, to follow through with this policy in other fronts, whether it be Greenland, whether it be Panama, Colombia, et cetera.
How is the U.S. positioned differently now than it was post-World War II when we were seen as a global superpower when we talk about this?
Right. Well, World War II was the watershed moment in U.S. history. It was the time we went from being a relatively isolationist power, one that focused on our home region, again, the Monroe Doctrine, to one that was interested in maintaining a global order. And what we're seeing is, among some segments of the administration now, a desire to return to what we were before World War II. A dominant power in its home hemisphere and one that largely stays out of the affairs of the rest of the world. We're looking at a world that could, in fact, be divided into, if you will, spheres of influence, with China having a very strong role in Asia, Russia and Europe having some form of control over that part of the world, and then the U.S. having a dominant role in the Western Hemisphere.
Now, you've been talking about workforce issues with groups in our area, Team NEO, Greater Cleveland Partnership, for example. What is it that you see for Ohio's workforce in 2026 that you're bringing up in those conversations?
Well, there's two things. We've long been dealing with labor shortages here in Northeast Ohio. Our population growth has been declining. Our birth rate is declining. Now we have a cutoff in immigration. So this is a real threat to our working age population, which is set to shrink by anywhere from 5 to 10% over the next couple decades. At the same time, we're seeing a skills mismatch. So not only do employers struggle to find workers, but now they're struggling to find workers who have the skills that are needed for their businesses. You add to that now this technological changes that we're seeing, and now workers themselves, even though there are shortages of workers, are finding themselves suddenly no longer needed by a workforce that they expected to have a nice, comfortable job in. Think about young lawyers or young accountants who assume that they will start a business, they'll start working for a business in their 20s, they'll move their way up and become partners of that business at some point. Those stepping stones are now being removed by technology. AI is doing the research for lawyers. AI is doing the financial calculations for accounting firms. And this is a real challenge for young people here in Northeast Ohio. So both sides of the equation, employers struggling to find the workers with the skills they need, and employees or wannabe employees struggling to find companies that have roles that fit their skill set.
So what do we do about that? What do we do about the issue, I'll say, problem, maybe, I don't know, of artificial intelligence? What do we do about that here in Northeast Ohio?
Well, we do a couple of things. One, we have to educate the public better on artificial intelligence, how to utilize it, what the impact it will be on their lives. And that's up to the communities in many ways. Communities should be promoting AI education, subsidizing AI education, because it is going to transform our economy, the careers of most people. So we really need to be investing more in that. And those regions that do that are going to have a big advantage over those that don't, because businesses are going to gravitate to those regions where there's a very AI-savvy workforce as opposed to one that is much less comfortable with the new technology. It's not going to go away. We can't close Pandora's box. We're in an arms race with China as far as AI is concerned, so these developments are going to continue at a rapid pace. And if Northeast Ohio can get on top of those developments and have a workforce in place that's very well AI educated, it's a great opportunity for this region.
We didn't even get into the issue of the water supply and what that will do with artificial intelligence. Topic for another day. Last question I have for you. Tonight you're speaking at the Parma Snow branch of the Cuyahoga County Public Library. The Cleveland Council on World Affairs is hosting this. Very quickly, what's the most interesting thing to you that you'll be talking about tonight?
Well, besides my bad Cleveland Browns jokes, I will be talking a lot about how people can adjust to this new reality, this new world that we live in. Usually, I've been doing these speeches for over 25 years, and I talk a lot about the economics, the politics, the technology. In this year's speech, I'm really talking a lot about how can businesses, how can individuals, how can communities adjust to these changes and succeed in what is a rapidly changing world.
Something that will be very interesting for the people in attendance there. Michael Weidekall, founder and executive director of the group International Strategic Analysis. Thank you for the time today.
Thank you.
We'll take another quick break, and on the other side, we will look back at the history of Otto Moser's, a once beloved Cleveland restaurant. This is The Sound of Ideas. I'm Stephanie Haney. We'll be right back.
Your source for NPR news and information. This is IdeaStream Public Media.
This is The Sound of Ideas from IdeaStream Public Media. I'm Stephanie Haney. Thank you for staying with us. Cleveland holds a special place in the histories of comedy, rock and roll, and theater. A century ago, dozens of venues in and around Playhouse Square offered audiences the chance to experience the art of vaudeville. And one of the most famous watering holes for performers was Otto Moser's Pub. IdeaStream Public Media's Kabir Bhatia spoke with Christopher Roy, author of the book Mr. Moser's Neighborhood. Here's that conversation.
We've done this sketch 11,000 times. You know why we've been doing it the same way for 43 years? Because it's good.
And you know why we don't do it anymore? Because we've been doing it for 43 years.
For most people today, Neil Simon's The Sunshine Boys might be their only glimpse into the world of vaudeville. 50 years ago, George Burns won an Oscar for his role in the film. 50 years before that, he was an actual touring vaudevillian. During a layover in Cleveland, he married his partner, Gracie Allen. Before the rise of moving pictures and radio, they were among hundreds of acts singing, dancing, and joking their way around the country.
Jimmy Cagney, Fred Astaire, Cary Grant, W.C. Fields, Judy Garland.
That's Christopher Roy from Shaker Heights. A few years ago, he was volunteering in the Special Collections Library at Cleveland State University when boxes began arriving from a recently closed restaurant. Inside were hundreds of photos, many autographed, that had been on the walls of Otto Moser's. Roy realized they represented an undocumented vein of history, vaudeville performers in Cleveland.
Cleveland State helped me scan all 650 photos, the great majority of which were illegibly signed, sometimes dated, often blurred. For roughly the next 18 months, I spent just trying to identify all of these people who in the main were vaudevillians who had dined, drank, hidden out at Otto Moser's between roughly 1895 and about 1930, which tended to mark the end of vaudeville. And interestingly, one of the most astonishing discoveries was how common vaudeville was in the era before talking pictures and to a large extent silent pictures. In downtown Cleveland alone, there were more than 60 live theaters within, say, a 1 mile distance from Otto Moser's restaurant, which was on East 4th Street near Euclid Avenue. 60 theaters, all performing stage events, primarily focused on vaudeville, but occasionally more classical plays, Shakespeare stuff, opera, et cetera, et cetera, et cetera. So those all kind of melded into what ultimately became a book, how Cleveland's vaudeville scene unfolded, who the actors were that not only were displayed at Otto Moser's, but visited Cleveland, where their performances were, and what the general social scene was during this era of live theater.
So today, we think of Playhouse Square as about a dozen theaters, and you go see a big splashy musical, or maybe a stand-up comedian, or a public speaker. But vaudeville was a different animal. It was a different vibe, especially when you had 10 times as many theaters. So give people a sense of how it was compared to today.
Well, you hit on one of the main distinctions, which is simply the quantity of theaters, the nature of the performances, which typically changed weekly. God knows how many performers would arrive by train in one of two stations, either the old Penn Station in the Flats or Union Station, which was on the lakefront. They'd spend a week there doing what vaudevillians or performers in general do: act, eat, sleep, and party. So there was a larger quantity, which tends to change the vibe in the area all on its own. But it also was a very different thing simply because Cleveland was a much more compact place. So there's a sense of crowding that one almost might liken to Times Square. It was a crowded place. By roughly the turn of the century, Cleveland had 800,000 people. The Playhouse Square theaters, incidentally, two of them, the Palace and the State, were initially vaudeville theaters. They were built in the early 1920s to show vaudeville, which was already starting to wane. It's kind of impossible to say how many people were aware that this was, if not a dying art, let's just say that it had a high temperature.
Now, what killed vaudeville? I know that movies were a factor, certainly radio. You've said that a lot of the performers were just burned out, but what else?
After the First World War, there was a true sea change in people's attitudes towards foreigners. Basically, diversity, tolerance, acceptance of foreign others went pretty much out of style. Largely, it was brought on by, say, the sudden hatred of Germans during the war, but it spread dramatically after the war as well. Germans continued to be somewhat, for lack of a better term, persona non grata. But it also spread to Italians who were perceived as anarchists, lazy or troublesome. Even, Jews have always had a problem, a perceptual problem, but by the 1920s, early 1920s, the United States had passed incredibly stringent or strict immigration laws, and there was very, very little immigrant traffic coming into the United States, and immigrants or the sons or grandsons, daughters of immigrants were vaudeville's bread and butter. They went not just because it was fun entertainment, but because a very large percentage of any individual vaudeville show would not require an understanding of the English language. You could see an animal act, you could see a juggler, even a ventriloquist or a singer or a dancer. You don't need to speak English to enjoy somebody dancing.
That's a good point. It was kind of universal entertainment back then. But even though vaudeville was declining in all the big cities, we here in Cleveland, we had something that those other cities didn't. We had Otto Mosher's. So what made the restaurant so special?
Beyond the fact that Otto Mosher made this decision from the very beginning when the restaurant opened, which was 1893, incidentally, I'm inclined to think that it was his choice to hang the pictures that, historically speaking, differentiated his pub from hundreds and hundreds of others. There was also proximity. He was, in every sense of the word, the right person in the right place at the right time. Directly across East 4th Street was Cleveland's most important vaudeville theater, the Euclid Avenue Opera House, which was just a poster child for financial gluttony. Gold filigree, marble floors, gorgeous chandeliers, velvet seats, et cetera, et cetera. It was where everybody went to see and be seen. And it was 30 feet from Otto Mosher's. Moreover, there is reputed to be, or to have been, a tunnel that ran underneath the Euclid Avenue Opera House and came up in Otto Mosher's basement. Now, that allowed vaudevillians an opportunity to slip out or slip in before a show, after a show, or even during a show. And as I may have mentioned in the book, actors are particularly thirsty people. So proximity made a huge difference. He was the right person in the right place at the right time. He just made a couple of good choices, both for location and decor. He served basic pub food. He served heavy beer. He was a crotchety, jowly German who, in all likelihood, had no particular affinity for vaudeville.
To get the last word on today's topics, you can email us at soi@ideastream.org or message us at The Sound of Ideas on Instagram. Yesterday, we brought you new reporting about how Ohio relies heavily on volunteer firefighters rather than full-time paid professionals. Claudia emailed and asked, does homeowner insurance ever pay for the cost of the emergency response or support fire department response in any way? Our reporter Abigail Botar shared this answer with us. I don't believe homeowners insurance pays for emergency response, but health insurance can. A lot of these departments' budgets come from billing for ambulances. That means that if departments aren't getting ambulances out fast enough, or if mutual aid is picking up the call instead, the departments are actually losing money. Some departments we spoke to even run emergency medical services and either contract with a private ambulance company or a local department that has EMS. Thanks for writing in, Claudia, and for the answer, Abigail. You can check out the full Sound the Alarm series on ideastream.org. Tomorrow on The Sound of Ideas, we'll talk about allegations of daycare fraud here in Ohio and how Northeast Ohioans are reacting to the killing of Renee Good by an ICE agent. Plus, a new American Experience documentary on PBS tells the story of Cleveland journalist Charles Loeb and the aftermath of the atomic bombings in Japan during World War II. Thanks for being with us here on The Sound of Ideas and keeping the conversation going. I'm Stephanie Haney. We'll see you back here tomorrow.